Your latest study shows intensive lifestyle changes may sometimes reverse cognitive decline in early Alzheimer's patients. From
Correct.
your research, what are the most important lessons patients and physicians should take away?
Well, to have a sense of hope, because most people, when they're diagnosed with Alzheimer's, they take their hope away. My mom died of it, so I saw it firsthand. They say, I'm sorry, Mr. Jones or Miss Smith, you've got Alzheimer's. It's only going to get worse. At best, the new drugs just slow it down a little bit, so get your affairs in order. If there's anything you want to do it soon because you don't have much time. And it's devastating. It almost becomes self-fulfilling. It's almost like the brain starts to shut down when you take someone's hope away. And when you lose your memories, you lose everything. People used to view heart disease in 1980s when I started doing these studies, the way they view Alzheimer's today, that once you had heart disease, the best you could do is slow down the rate at which you got worse. But we showed that when you make bigger changes in lifestyle, and not just with diet, but meditation and exercise and social support, to reduce it to its essence, to eat well, move more, stress less, and love more, that the heart disease could get better and better over time. And we are now finding the same thing with early stage Alzheimer's disease in many cases. It's why what's good for your heart is good for your brain, because, again, they share so many of the same underlying biological mechanisms. So we found that after 20 weeks, over 70% of the people could stop the disease from getting worse or improve their cognition by making these lifestyle changes. And we recently reported our findings at the Alzheimer's Association International Conference that after 40 weeks, there was even more improvement. This is a woman who's got both of the Alzheimer's genes, the ApoE4 genes, not even a candidate for the drugs because the drugs are contraindicated if you have both genes. The new like aducanumab and lecanemab and so on. She couldn't cook because she'd forget and leave the burner on. She couldn't read a book because she'd forget the paragraph she just read and had to keep starting over again. Couldn't watch a movie because she couldn't follow the plot, couldn't do her taxes, and now can do all of those things. So, as a scientist, it's very gratifying to look at the data, but as a doctor, just being able to give many people a sense of hope and empowerment is really one of the best feelings that I have. Now, I want to emphasize, not everybody gets better. Again, there's nothing works all the time for everyone, but on average, most people can at least stop the disease from getting worse. Billions of dollars have been spent on drugs to treat Alzheimer's. Only 3 have been approved in the last 20 years, and they all work to move amyloid out of the brain. But they only slow down the rate at which you get worse. But getting worse more slowly is still getting worse. And so the suicide rate in the first month after being diagnosed with Alzheimer's is 7 times higher because they take your hope away. So we found that when you make bigger changes, the amyloid also comes out of the brain. What's called the A beta 42/40 ratio improves. But also we're working on these other biological mechanisms that we talked about earlier, chronic inflammation and so on, that affect Alzheimer's and prostate cancer and all these other conditions. So the combination of moving amyloid out of the brain and these other mechanisms gets a bigger treatment effect than just moving amyloid alone, which the drugs do, at a fraction of the cost. And as I mentioned, instead of having bleeding into your brain and brain swelling and other common side effects like that, the only side effects of making lifestyle changes are good ones.